Everyone, thank you for joining us. If you go back 6 months in March and April, it was really scary. And I'm very, very concerned right now. On any given day, any year, we get 30 Flatbush Hatzalah calls a day. We went up to as many as 150 calls a day back in April. I'm seeing now in the past 2 months, July and August, September, our call volume is way, way down. People are petrified to go to a hospital and they're not calling us. But right now, in the past month, and really the past couple of weeks, the call volume has been way up. I hear the dispatcher every single day speak about PPE, which means that we're walking into a COVID call every single time. There are people in the past week, I know personally, because I don't have all statistics because of HIPAA laws, we're not allowed to really call people after to find out if they have COVID or not. However, I do know that I sent people from Deal to NYU, to Lenox Hill, Cornell, Mount Sinai, about at least 5, 6 people from Deal in the past, I would say in the past week. Every day in Brooklyn, we're sending people to Maimonides, we're sending people to the city. And I'll give you one example. We have a father in Deal that is in the city in a hospital. His son here in Brooklyn has COVID. His wife went to quarantine in Deal to stay away from him. And we took him to the city today because his oxygenation was very, very low. The calls we're getting are extreme. We're not getting anything like we had in April. However, we're getting a lot of people that have difficulty breathing. And right now, people are petrified and they're staying home. I want to encourage people, if they know of anyone that's homesick, don't be a martyr and don't think that you could just stay home and take care of yourself at home. There are times that you need to call your doctor and find out what the vitals are and find out if you should be going to a hospital. The hospitals today can do a lot of therapy that they didn't know back in April, and they're not full as they were in April. And I encourage everyone to don't wait and get sicker at home because you're physically getting your body more infected, and the doctors can talk more to it than me. But there are definite, therapies that they can do in the hospital that you cannot do at home. Oxygen at home is okay if your levels are 92 or above. You can possibly stay home, but below 92, you really belong in a hospital. So I just want to encourage everyone that it is a real fear, and we're getting a lot of calls, and I'm scared because of what's happening that the calls are going to continue to grow because it's a very, very contagious strain from what I'm hearing right now. And so many people, like in the Deal Kollel, it could be up to 60 or 80 people that got it before Yom Kippur. So I just encourage everyone to really take it seriously. Whatever we hear tonight and learn, we have to really make sure that we are all vigilant, and whatever we all need to do together with our families to protect ourselves, we need to do.
Hi, Dr. Daniel Madelon, and any of the other doctors, if you have anything to add, please do. I want to echo what Alan S. has said. I want to display some of the myths. That this is not a mild disease. This is not a milder form of disease. This is not a falsely elevated positivity rate. This is very real. We're seeing many hospitalizations. Just from speaking to a couple of the doctors on this call today, I know of 14 or 15 hospitalizations today from our community. Unfortunately, we know there are 2 fatalities in our community earlier this week. This is a very real disease. This is just as deadly as it was before. Thank God, as Alan says, the hospitals are better equipped. There are better medications. It's important to go to the hospital. But we all have to know that preventing this from spreading more is really the key to saving lives, really the key to saving lives. We've been told and we know there's only 2 ways to decrease the rate of infection. We can either shut everything down as we did before and everyone lock yourself in your house, or we could do mass testing and tracing. Test and trace everyone in the community, find the people who are infected and may not even know it, get them isolated, get their families quarantined. And this is really the only way that we could stop the spread and save people's lives and save health. It's vital that we do it. We must do it now. It's already late in the game because the number of infections is already astronomical in the community. as was said before, absolutely everyone must wear masks all the time, everywhere. I don't know if it was mentioned yet or not, but we cannot continue to have large gatherings. We cannot continue to have our beautiful large weddings. Those have to go down to the way they were back in May, back in June. And we really need the rabbis' support to make sure that this happens. It's only with the rabbis making sure that hosts do not do huge gatherings and large weddings. It's the only way it's going to happen. The only way that people are going to go to get tested is if it's encouraged by the rabbis and repeatedly encouraged. And from the pulpit, we have some volunteers from our community that are working very hard to set up testing sites. There's going to be multiple testing sites available in the community to get results back within a day or so we can know who's infected. It's really the only way that we could stem the tide of infection, save us from more fatalities, save from more people being hospitalized and being put in the ICU, and hopefully being able to save keeping our institutions open. But I want to implore all the leaders of our community to make sure people are responsible and people get tested.
So I just want to echo and thank all the speakers before me, and I reiterate 100% and support everything everybody has said before me. I think that Dr. Malon said it perfectly. I don't have a lot to add, but I do want to say that it's a very, very important thing. Don't underestimate the impact that the people on this call have. So a unified strategy from well-respected lay leaders in our community, doctors, and of course the rabbis, everybody giving the same message is not only a very powerful message for everyone, because everybody reaches different people in different ways, but I think if we all have a unified strategy, it'd be a beautiful thing for lots of reasons. I think people will listen. I think it's the right thing to do in terms of getting tested. I think it's the right thing to do in terms of the government. And it's the right thing to do as a cohesive strategy for the community and show the rest of the community that we're all on the same team in a very significant crisis. And if nothing else, it'll help save lives. And it's a tremendous Kiddush Hashem to basically show the government and show the people that are looking at us as a microcosm of sort of what they want to do, show them that we're better than we actually could be, drive the numbers down, but drive them down correctly. But I think if we do it in a nice way and we show everybody's working together for the same goal, it'll have a tremendous impact. And everybody on this call can make a tremendous impact on their own little circle of whatever they can reach. Doctors, lay people, definitely rabbis. If we all speak together, I think we can really, really get a nice handle on this. I don't want to underestimate the gravity of the situation. I'm not trying to put a silver lining on it, but I think working together will go a long way.
And I think that at least the question I've been hearing like all day, every day is about the holidays. We have to stress that people should stay home alone on the holidays. It's not the time. If anybody has a COVID positive exposure, they should really push to stay home alone. You understand? I have people who are fasting who should not have been fasting. And we're tanking them with fluids now because it's 3 days later. And it's all right not to be with your family on the holiday. It's all right. You know, even if it's outside, if there's a positive exposure, quarantine, sit inside. You don't have to be in a sukkah. We make so many sins. We don't have to worry about sukkah right now. I mean,
Remember one point. Remember one point. Purim was 1 day. We're going into an 8-day holiday.
Correct. That's even scarier.
Just to give you a little bit of my experience in the last week or two, for 2 to 3 months, we had no positive cases on the labor floor at Mount Sinai. Back in March and April, we were bombarded. We screen every patient who comes in, so we really have a captive audience. Everybody gets screened. In the last 2 weeks, we had numerous positives. So that's not anecdotal, that's fact. We see it, we live it, it's confirmed. In the governor's email today, the zip code, according to his email, with the highest rate of positivity in New York City, exclusive of 2 zip codes up in Rockland County, was 11230, where I live. A thought I had, which is what I wanted to add to the conversation, was there's no data on this. I'm just thinking, theoretically, being outdoors, we know, is a wonderful way of minimizing the risk. Being indoors increases the risk tremendously. I surmise that sitting outdoors in a sukkah is not the same as sitting outdoors. So I think a lot of people are probably under the impression that I can have a huge, large sukkah and have 20, 30 people over and have friends and family. I don't know that that's the case. I personally wouldn't do that. I think being outdoors in Sukkot doesn't have the ventilation that being truly outdoors does. I don't know if my colleagues will agree. Certainly no data to prove or disprove that at this point, but that might be a message we wish to share, that in absence of knowledge that sitting outdoors in Sukkot is safe, we should probably limit gatherings in Sukkot as well.
I could just echo what Victor said. So yeah, I agree with you regarding Sukkot, and the health department in Israel also agrees, and they've given their recommendations for how to construct the Sukkot to make it safe. But I certainly agree that a Sukkot is closer to indoors than outdoors as far as ventilation.
I echo those. I agree with you too, Victor. I think it's going to be a problem.
We've been getting 10 to 15 phone calls per day and trying to add on telemedicine visits. So the office is, a lot of offices are overwhelmed, and, we're overflowing with patients and phone calls, and, it's multiple phone calls for the same patients, not getting better. We were saying before, I had to send a couple of patients, to the hospital in the past 24, 48 hours, a younger lady in her 50s, another younger lady in her late 40s, and another man in his early 60s. So it's not necessarily, the 80-year-olds. And so it's affecting everybody. Again, synagogues, weddings, those are the super spreaders. And we really have to focus on that. And, like the other doctors, I'm also willing to help if speak to anybody if needed.
There's no absolute answer to that. The answer is as quick as we could get everyone tested. And in reality, it's not just testing people once and get one snapshot. As we know that people can be exposed and not yet show signs or not yet be positive on tests. So it's probably going to be a couple of rounds of testing over a few week period, but the sooner the better. And the more people we can get tested ASAP, the more we can get isolated if they're positive. There's no complete answer to that, but I'd say the sooner the better.
But also to echo that, so Rabbi Tal, so there's no way we'll have enough testing and tracing before the first beginning of Sukkot. It's virtually impossible. So with that being said, the distancing and the mask and the separation in the outdoors is even paramount, is more paramount importance. So it's very, very important to keep that message going through the holiday. I can't imagine we're going to have a lot of different numbers in 2 days. So possibly by some Torah, I don't know, but right now we didn't get started yet.
So, thank you everyone for being on the call. I just wanted to mention a couple of things. Number one, something that was not mentioned, but it was mentioned in yesterday's call with Dr. Katz with regards to the virus. There's a misconception that the virus, its strain has weakened, but it's not really true, or at least it has not been proven, but rather the people that are infected or that have been infected, I should say, they tend to have been younger, and as a result, they are overcoming these viruses. What we are seeing, however, is those that are older, those with underlying medical problems like obesity, lung disorders, diabetes, these people, for the most part, are getting the same types of infections or the complications of the infections that we were seeing in March, April, and May. In addition, we do have better treatment today, which I believe Mr. Esses mentioned earlier. And that's one of the reasons why, thankfully, people are doing somewhat better in the hospitals. So you're seeing the death rate or the complications of COVID being much less these days than they were back then. But again, this is still the very beginning of what we suspect or expect to be a second wave or a second pandemic, because we're going to have to deal with the flu as well. So I think it's really important that the doctors and Mr. Beta and Charlie, the information that the doctors are presenting and they are discussing, it's passed along to the rabbis, because what I've noticed is a lot of congregants, before they go to their doctors, for example, for Yom Kippur or for different events, they are actually asking the rabbis first what they should do, whether they should fast, whether they should not fast, whether they should go to an event or not. So the rabbis themselves have a very important role here, and they really should be educated. I'm sure they know a lot about what's going on, but I think they should really know a lot of the specifics in terms of what needs to be done and when the boundary is crossed, and when they should refer to the doctor as opposed to them making a decision on whether or not someone is safe to go to a certain event or able to come to shul or able to fast, as an example. So I think that the information that we're talking about today, I think it's very clear, of what we're expecting, what we're anticipating, the gravity of the situation. And I think from here, we're going to have to relay all that information to the rabbis to present on our behalf, in conjunction, obviously, with us. So I think, like I said, the rabbis have a very important role here, and we will certainly back you.
There have been case reports of people being reinfected. It's quite rare. But you have to remember one thing. We know very little about this virus because it's only been here since March. So we really have no idea what the long-term ramifications of the possibility of being reinfected. I think having a minyan with people who have already been infected before could be a catastrophic problem because we just don't have the knowledge going forward that we do have as, say, things that we've dealt with before, like the flu or measles, something like that. So there are case reports of reinfections. They are very, very, very rare. So it's unlikely you're going to see them, but it's definitely not impossible. We don't have any idea about the understanding of the immunity, how long it lasts, B-cell immunity, T-cell immunity. So I think I would argue against that, personally.
I would just add that currently there are 2 documented cases of reinfection in the world. I believe Dr. Madelon is going to mention right after me that there is going to be another published report of a few additional cases. But it's very difficult to prove that someone is reinfected because they actually have to look at the DNA of the strain that they had previously and what they have at the current time. But currently there's 2 reported cases. One was in China, one was in Nevada. Both patients had more or less mild disease, but it has been documented. The reinfection has been documented.
So yeah, what Dr. Hostia said is very true. It's almost impossible to prove a reinfection. They need the samples from back in March, the samples now, check the DNA of the virus. That's why there's only 2 documented cases. It's almost impossible to prove, but there are certainly several cases that we've seen. We've seen a few in the community. We know that it's reinfection because they had it before. They're better for months, and they had the very typical symptoms. By and large, these have been mild cases, but the feeling is that if someone can get reinfected, they could certainly give it to others. I was told earlier this week of a reinfection of someone in Lakewood, not from our community, but with active antibodies. He recently tested and had antibodies, and he was sick enough to be hospitalized. Again, like Dr. Shrem said, very rare, but it's happening. And as time goes on, I think we're going to see more of it because immunity does slowly wane over time.
I would just add that from the reports that I read, you basically get 3 free months of protection. So basically the cases where the patients did get reinfection, it was after the 3 months. So they were hesitant to say it, but the main publisher of the study did mention that he thought that the first 3 months of antibody protection should be sufficient for the protection during that time.
Just to say another point with regards to that, in terms of testing, if you were positive within the past 3 months, you shouldn't go for any testing.
If somebody has antibodies, they say, oh, I have antibodies, I could go, I could even, you could still transmit the virus. It's very important for them to understand that. People coming to shul, no mask, said, oh, I have antibodies, it's not a problem. And they have primary exposure. The wife has it, sister has it. And it's another big thing that I think needs to be stressed. And people think that it's a free pass if they have the antibodies.
I've spoken to several people regarding Dr. Friedman from Lakewood and other doctors that he's worked with and that share the same opinion as him. Their opinions are directly opposed to the Center for Disease Control and Department of Health. It's really an irresponsible, in my opinion, irresponsible thing to say that people with antibodies cannot spread disease. There's no proof to that. As a matter of fact, there's some proof to the contrary. And that's really a very small minority of doctors are saying this, but unfortunately they're advising some schools and some yeshivot on COVID. And this is very, very dangerous advice, in my opinion. I mean, obviously, we know what to do. We know what's safe. Outdoor is much safer than indoor. Smaller and very small is much safer than larger. Can we put an absolute number on it? I'm not going to be the one to put a number on it, but the smaller, the better. If we don't make it small and we don't, and this disease keeps spreading, then the city and state will do it for us, and we'll be stuck with 10 people per wedding. So it's got to be, yes, absolutely.
And Denny, a tent that's made to be indoors is not a tent.